Did you know that in veterinary medicine there are specialists who deal with dental disease along with oral and facial surgeries? Join me to hear about my recent adventure taking my 7-year-old Labrador Retriever to a veterinary dentist. I do have a few previous videos. They are from a number of years ago, so please forgive the more rudimentary style of them. But if you've missed those, you may want to go and give them a watch, as there's a lot of information in there that everybody who lives with dogs and cats should know. Overall, as a GP veterinarian, I am more than happy to do cohats for my patients. However, there are a number of things that I'm not equipped to do in general practice. I don't have any access to advanced imaging like a CT. I don't know how to do procedures like root canals and crowns. And of course, my knowledge base is not nearly as extensive as the knowledge base of a veterinary dentist. So I will always offer to my clients referral to a veterinary dentist if they wish to do so. Another benefit of a veterinary dentist is because all that team does all day, every day is dental care, they are generally going to be faster. And we do know that the length of a procedure does link with the complication rate. Shorter procedures are going to be a little bit less risky for patients than longer procedures are. Of course, going to see a veterinary dentist is going to cost a significant amount more than most GP cohats will end up being. My job is to offer all the options to people, and then it is their job to decide what is best for their individual situation. Now, when it comes to my personal dog, Adelaide, in March, I ended up noticing a couple of changes with her that seemed to be associated with oral pain. Let me cover a list of very common things that will occur in pets that have oral pain, and I wish that every single person living with a cat or a dog knew this list. When they are chewing, they may start dropping crumbs. You can also sometimes note a change in temperature sensitivity. I especially will find this related to cold items, say drinking out of cold water versus not wanting to do that anymore, or if you're offering frozen food puzzles, maybe they won't be as keen to get into those as they used to be. So overall, any change in eating and or drinking habits. If you've been brushing their teeth, you might notice a change in their behavior when you're going and doing that. They might start pulling away from you, they might be a little less cooperative, they might start getting grabby with their reinforcement for the toothbrushing behavior. If you have an animal that likes to kind of gnaw on things or chew on items, you may notice a change in those chewing habits as well. Some animals will start to have different amounts of drool than they used to. This can go for cats or dogs. Also, when you are looking at your animal's teeth, if you are seeing red gums, this is called gingivitis. Or if you are seeing any changes to the color of the teeth, they might go gray or even pink. You might see broken sections of teeth. Any changes are things to make a note of and bring up to your veterinarian. For Adelaide, I noticed a change in dropping some frozen food puzzles and not wanting to drink water that was cold, say from cold puddles. I also noticed that she was dropping some crumbs from her TD kibble. Now, this alone would simply trigger me to schedule another cohat for my dog. However, her last set of intraoral x-rays had shown some changes to the roots of her fives in all 4 quadrants. The fives, 105, 205, 305, and 405, are the first premolars right behind her canines. I thought, okay, now that she has signs of pain and I know that I have some questions about her fives, I want to consult a veterinary dentist. I did this also because they do have access to CT that I don't have, and getting that additional detail, even with the roots of those fives, could be helpful in deciding what to do. Also with CT, they can do things like image ear canals and the TMJ, and then additionally, when I bring my dog to a specialist, I don't have to be making all of the decisions, monitoring, working, and being my dog's guardian. All I have to do is be the guardian in that situation. And when we are getting into making complicated decisions or doing more complex procedures, that is my personal preference. And I know a lot of veterinarians who are the same. So we just don't like working on our own pets in some situations. There are no veterinary dentists where I live, so I did have to drive a couple of hours to get to one, and it did make it quite a long day. However, the experience was lovely. We did do CT imaging of her skull, including her TMJ and all of her teeth. We found that she is having some resorption of the roots of those fives. It has progressed since the last time she had those intraoral rads, where there were just the very slightest of changes. Now there's quite significant tooth resorption. However, the teeth still probe completely normally, didn't appear painful on exam, and they also don't have any gingivitis. So the veterinary dentist said that it is still the correct call to simply leave them for now. In the future, they may end up needing to be extracted or have crown amputations. We don't have a ton of information about tooth resorption in dogs. It's theorized that there's likely a genetic component, but we don't know for sure. Adelaide does also have some aging changes around her TMJ and some jaw muscles near there. Thankfully, she did not require any extractions, and the rest of her mouth looked great. This is somewhat frustrating and also somewhat a relief, because we don't have a definitive answer at this point as to what is causing the symptoms. So the plan is to continue monitoring those fives, and the other thing that we're going to do is see if some fluoride treatments will be helpful, because the veterinary dentist is wondering if maybe as she's getting older, if her enamel is getting a bit thinner or just a bit worse than it used to be, and that could be causing this temperature sensitivity. Now you do have to be very careful, because of course dogs are going to swallow things like human toothpaste that has fluoride in it, which is why we generally use pet toothpaste. The pet toothpaste generally made to be safe for swallowing. Do not just start using fluoride toothpaste with your own animals. Thankfully, my dog did recover pretty well from general anesthesia. It took her about 24 hours and then she was back to her usual self. I wanted to use this experience to remind all of you that your cats and dogs do need regular dental procedures that are under general anesthesia, and that include intraoral x-rays as a bare minimum, if not more advanced imaging. It's impossible for us to tell the health of teeth without knowing what the roots are doing underneath the gum line. If you've got any questions, don't hesitate to let me know, and also leave a comment if there's a video topic you'd like me to cover in the future. I hope that you and your critters are doing well, and we will see you in the next one. Bye-bye.